Hello, it's me, getting later each time. Trying to make up for the terrible hair of last time with like an almost good hair day. Almost. From very far away, I look like a French lady. Close up, not so much. Okay, so after last week, I went to physical therapy again. And this is only the second time I'd seen this person. There'd been like kind of personnel issues, which I'm actually finding is endemic to a lot of physical therapy places. And it keeps patient and provider on the back foot because you're constantly having to describe what's going on. And then also there's no sense of like trajectory or improvement. Anyway, so that's just another thing, like get that sorted out. All physical therapy places. Anyway, with the exception of the place I went to in Minnesota, which was flawless. And so last week, one of the interesting things was on the doctor's specific notes, she went to work on my occipital area here, which is 100% a place where a lot of tension and like tension headaches comes from for me, and also a lot of other string players. And so just kind of because I feel chronically starved for information about this, I went and looked up some studies about the occipital area, the muscles that descend up and down here, and then thoracic outlet syndrome. And what I came across is a whole bunch of stuff, but is what is going to be directly underneath this, which I found absolutely fascinating and has never once been discussed by any of my providers. And I had been kind of piecing it together with the exception of the occipital area and muscles, like by myself. So remember, I think I said maybe on the second video, maybe it was the third, I was like, yeah, and whenever we work my hips, like this area definitely opens up. And so you'll read that there is a kind of axis going up and down the body, and of course there are these large connections of fascia, like the kind of, it's hard to describe fascia, but it's basically like this overlying web of connective tissue that kind of holds our muscles against the frame and creates its own connection to the muscles. Anyway, so like the whole left side of my body is kind of crapped out, and I've had terrible knee troubles. I used to run kind of a middle distance, not competitively or anything, but when we lived near the Van Nuys airport, there are two tracks. There's like a 6 and there's an 11, and I would do both of those sometimes, and running. And then that gradually, because of this stuff, wore away a lot of the cartilage. So between my two big, bones coming down off my femur and then through the kneecap area, I just ground it because the psoas, spelled P-S-O-A-S, is this kind of very notoriously hard to get to, hard to release, hard to strengthen muscle that runs kind of down, like in front of and around your iliac, aka like the hip bone crest, and it kind of disappears back into your body. Anyway, this is a really finicky muscle, and according to this and some other literature, you can kind of cause it. Usually these things come together, but so a slightly forward head posture can actually start upsetting the psoas. Or even if you're pretty mellow here, which I'm working on still, if the psoas is not treated appropriately, aka if it is put under undue stress or the muscles around it are not supportive or working with full functionality, it can actually start to twist or tilt the pelvis. And my x-ray is pretty astonishing. It's both twisted and tilted on the left, and my left leg is actually like, it's either 3/4 of an inch shorter than my right, or it's 3/4 of an inch past the point where people are like, oh, that's okay, because there is, of course, a little bit of difference in most people's legs. Anyway, I just remember a doctor was like measuring, it was like, that's too much, and I remember him writing 3/4 of an inch down. Anyway, but not only that, so I've got, knee problems. I had some plantar fasciitis on this side, luckily. Hasn't happened too long anyway, but I've had lots and lots of problems through my hip. My hip flexors and adductors have been very weak. I've done yoga for like my whole adult life, and I've actually been very flexible. Like I thought that, oh, but I can do like splits on both sides, never the middle. I'm not that good. But I thought, oh, that it must not be a problem, but it could actually be a problem that it's not strong and it's weak and hypermobile. Anyway, but not only can that then cause, get this, so if your psoas is pulling your body out, you will get into a chin forward posture to balance yourself out. And in doing so, it actually compromises the erector muscles that run like train tracks down your spine. What this also does over time, and of course, as we know, I've had lots of time, it actually twists you a little bit and also can, so they say thoracic outlet syndrome is a thing that can happen because of the psoas, but it also has a link to the area like the diaphragmatic breathing and the chest cavity, and it can actually do things like decrease or strain your capacity for a full breath on that particular side. I was actually having, we've talked about this before, how my breaths, I used to kind of breathe up into here, which of course is very hard on the scalene. It's putting pressure on all these muscles in this rib, as opposed to like the belly breathing where you're supposed to kind of come out and be a little bit rounder and bigger and fuller in your belly. Anyway, so at the latest PT, which was on Monday, and I've got my next one on Friday, I came in there with like a long list, and I said, I am very dissatisfied with the way this has been going. Last session, you touched me for maybe 10 minutes, and then for 25 minutes, there were 2 or 3 people in this room trying to schedule your next appointment. Like, I'm not more important than your other patients, but there has to be some other time. Rather than this slim half an hour, I get the privilege of paying $1 a minute for, which I know is pretty good insurance, but as somebody who's not working very much right now, it's all going on the credit card. There's no money right now. So, that time needs to be spent addressing me. I don't think it's too much to ask. And they do have administrative time in their schedule. So it's like, anyway, but I also brought her this study that I'm including here. And then on Friday, I actually have a whole bunch more. And it just, she went in and did a really simple release of the psoas on both sides, which was super uncomfortable. And then I had Parsons do it once when I was at home, super uncomfortable. And certain symptoms, especially my scapula, are better. Like, that 1 to 10 pain rating, I'm at like a 1 on my scapula. So there's that. But then also, for whatever reason, being super organized about like presenting her that information and kind of having a set of polite but firm demands, it changed the whole way the physical therapy session felt. And I've had this thing kind of going on in my mind for a while that I've just thought, like, I wish there was a different or better way to talk to musicians about injuries and to also talk to physical therapists. Because, for instance, this girl has been practicing for a while. I looked up her credentials. She's a thoughtful, intuitive person who's been able to describe certain like motor functions and how things are actually should be working right now and what things power what. Because I'm worried about this last scalene doing what the first 2 that are no longer here did. Anyway, she had no idea about any of this stuff. And it just seems like with the ubiquity of head forward posture, I don't know, it just seems like something that, like, there should be like a fax that comes into every physical therapy office that's like, all these symptoms that read like the patient has 97 things different wrong with them. Do they have plantar fasciitis? Are they wearing away their meniscus? Do they have IT band syndrome? Do they have widespread hip dysfunction and weakness and hypermobility? Are they slouching forward at all? Do they have tingling and numbness and shooting pains? Does it appear like their nerves are somehow impinged and you can't find out why? Maybe it's the psoas. Like, I don't know, I just feel like that should have been broadcast because it is shown, it is repeatable, and it is an easy fix. It is a fix that takes time, but like decompressing the psoas is actually not that complicated, right? You just gotta get in there, make sure you're actually touching it and not going into the person's body cavity, and just compress it for like 3 10-second bursts while the person breathes. Like, it's not that hard. Anyway, so I'm kind of, when I'm not exhausted, because I am really still very tired. I have about 4 or 5 hours during the day where I can go do stuff. Being in the car exhausts me, standing up exhausts me. I can do a little better if I lie down at like 11 or 12 and just kind of give myself an hour lying down. I know, I'm doing like Improve My French podcast, trying to make it like, you know, like this isn't like the lost summer where I'm not doing anything with my mind. Anyway, so I'm teaching, not that much though. I would like some students. Anybody else take lessons with me? I'm here. And lessons actually greatly invigorate me. They make me feel connected to the instrument. They make me feel useful. They make me a little bit of money. That's good. A little bit less stress. But really, I've got about 5 hours and then I am done. I hurt and then I'm just overall just very, very tired. And I'm not getting great sleep, to be honest. There's not a comfortable position for me yet. Anyway, but in those useful hours, I am doing, I'm writing that curriculum, and right now I'm kind of shopping for a physical therapist counterpart who might want to come to a few music schools with me, who might want to come to a few PT practices, maybe even if they want to hear from the likes of us, some orthopedics or rehab physiatrist kind of practices, and just talk about the different ways musicians can and should be interrogated for good diagnosis. So that's what I'm working on right now. I have a little bit of energy because I took a nap. This is actual real bedhead. But anyway, so that's what I've got going right now. And hopefully I'll have that finished up, at least a prototype, in the next couple weeks, and I can start lobbing that around. Yeah, that's what I got going. That's my update. I've got my next physical therapy on Friday, and depending on how that goes, I might come back with a little update. Anyway, thank you. Talk to you later.